This is Jody Tropiano, the Content Director for Health, and I'm here with Acacia Parks, the Chief Scientist at Happify Health. Acacia, thanks for joining us.
My pleasure.
So we're going to chat a little bit about the mental health impact from the COVID-19 pandemic. So first, would just love if you could kind of give one alarming fact or statistic coming out of the pandemic around mental health that you think would help really frame this conversation.
So there were sort of disturbing statistics about mental health before COVID-19 hit, right? You've heard these numbers, like 1 in 5 Americans will experience a mental illness in a given year. And then that's sort of coupled with 70% of those people never seek treatment or never receive treatment for whatever reason. So when you add to that the kind of alarming, and the World Health Organization has talked a bit about the impact of emergency situations in general, that one of the main places you see that is in psychological distress, sleep issues, and then all of the kind of major mental illnesses. And you can see the alarm around these things developing is sort of illustrated by the FDA's recent guidance that makes digital treatments for mental health sort of just something you can release without regulation for the time being. So it's something that we should be taking very seriously, and it's also something that while people, I think, during, I would say, normal times might be more cagey or secretive, I think now literally everybody can name multiple people in their social networks who are experiencing depression, anxiety, maybe for the first time, maybe exacerbated. And I think that 6 months ago, I'd give a lecture and say 1 in 5 people have mental illness. So that means that 3 people in this room probably have a mental illness. And nobody could name who that person was, right? So I think the level of distress is high enough now that people are seeing it more than, so it's around more and people are more willing to talk about it.
Yep. And who do you think right now is the most at risk for increased mental or behavioral health challenges?
So, I think the obvious answer is going to be frontline health workers, right? So, you hear these reports of PTSD, trauma type experiences there. That's obviously really scary, but I also think there are other contexts where depression or anxiety appearing could be really harmful. So for example, people with chronic health conditions like coronary heart disease, diabetes, these conditions are all exacerbated by mental health issues. So a person who might have originally had their health condition under pretty good control may find that in the experience of depression and anxiety, that's no longer the case.
Mm-hmm. And how are digital solutions helping with those groups or just in general?
So, I think the easiest answer to that is the sort of telehealth. It was existing before, right? Things like Doctor on Demand and Teledoc and these, or even just hospital systems offering remote visits. These existed before, but they are utilized more heavily now with good reason. So I think, telehealth is so important, but there's also this kind of a couple issues. One, telehealth is now overburdened, right? So if you need help via telehealth, it used to be, at least from my perspective, it used to be you could just make an appointment with somebody and within 20 minutes you're talking to somebody. And now you might need to make, you're getting the similar issues that you used to see in person where you could wait weeks or months before you can reach a practitioner. So along with that, I think there's also the need, like, obviously sometimes I speak about things like I helped create Happify. So like, obviously I think Happify is important, but the reason that I helped make it in the first place is because of this backup in healthcare where it's difficult to get immediate care. I think it's very important to have supplements of products like Happify that are available 24/7 that people can just access and get, immediate help. So it's not a replacement for therapy, but it can take weeks to get therapy. So it's a really important bridge both for helping people get immediate care, but also, and this is like another issue I think that's really important right now, with people experiencing things like depression and anxiety for the first time. So like I'll give an example for myself. So I've never had issues with anxiety, but in coronavirus I have.
Hmm.
And I have a PhD in psychology, so I'm aware of what it is. But you can imagine that for somebody who has no history of depression or anxiety, suddenly experiencing it for the first time, they may have no idea that that's what's going on with them.
Yeah.
And so I also think that there is an important role, not just for being able to reach a doctor remotely, and not just for digital tools that can kind of help you do things when you're not immediately with a doctor or when you can't access one, but also there's room for digital tools that can help people figure out what service they need.
Hmm.
Which might have originally been filled by going to a GP, and the GP might say, oh, I'm going to refer you to this or that. That may be harder to do now. So that's another place I've been thinking a lot is important. Is just this idea of being able to sort people out to different services digitally. That's something that we were started to build into Happify. It wasn't originally one of our goals, but especially since coronavirus, COVID-19, right? There are multiple coronaviruses, but ever since COVID-19 hit, we've seen over 80% increase in just demand for our service from employers, right? Employers are wanting to find something to give their employees, and they don't just want to give something that their employees can use, just a digital tool. They also want to help their employees get sorted to the right services. So that kind of demand from employers is what made us start thinking about sorting people between different types, right? So if a person comes in and they're actively suicidal, the answer is not a 24/7 automated digital tool. It's to sort them into live treatment. So it's important to have that kind of intelligent ability to sort people to the right resource.
Yeah. And how, you mentioned employers. So what advice would you give to employers just making sure their employees are okay during this time, knowing there's increased mental health challenges, but then also walking that fine line of privacy?
Yeah, that's tough. And, that's one of the things that I was concerned about early on when having employers give our product to people, is this concern that people won't want to be honest because it's perceived as coming from their employer, and they're worried about the ramifications of that. So I do think that there are ways to get around that. I mean, in our particular case, the way I've always thought about it is to just sort of de-emphasize things that people might find stigmatizing. So there's a pretty robust literature. I actually learned about this in graduate school, that you can impact a person's depression and anxiety without talking about their depression and anxiety. You don't have to tackle it head on. You can give them other things in their lives that can help them balance out their experience of depression and anxiety. So like to be more concrete, if you can teach a person to savor the experiences that they have with their family members instead of being on their phone, instead of being off thinking about work, like actually savoring those experiences, it's harder to be depressed, right? You don't have to talk about depression in order to reduce depression. So I think it's important when working, especially in an employer context where employees are very sensitive to, like, what's my employer asking? Why are they asking me this? What will they do with this information? To offer tools that are going to help with depression and anxiety, but not to make it about depression and anxiety. That could be a big a turnoff coming from your employer, or even from your health plan. Why is my health plan asking me this, right? So when we work with health plans, it's a similar issue. So that's one piece. And then the other piece too is, as I was talking about before, this idea of kind of referring and connecting. You can't just take a solution and offer it to all the employees, because some employees need to be in therapy, some employees need to be on medication, some employees will benefit very well from a digital tool, and some employees are doing fine. And the only way to know the difference is to have a way to kind of sort people out into the resources they need. So Happify does that through something called Happify Connect, which is kind of a screening and referral hub. But I think that's really important as well. to not just try a one size fits all kind of solution.
Mhm. That's great advice. And so the long-term mental and behavioral health ramifications from the pandemic are kind of undeniable at this point. Many are saying, I'm sure you see on Twitter, that that's a reason alone to ease social distancing sooner rather than later to kind of curb that trend towards increased mental and behavioral health challenges. So what's your response to that? Do you think that's a valid point, or we need to
So
keep with what we're doing?
I want to be clear that this is like Acacia Parks' opinion and not
Yes.
Happify Health's opinion. But personally, I believe that people underestimate our ability to adapt to new situations. So the urge to return to how things were is natural, in the same way that astronauts in outer space want to leave the shuttle because they're so stir crazy.
Mm-hmm.
But I don't think it makes sense to leave the shuttle, right? You can't breathe out there. And the metaphor holds that, the threat has not been dealt with. So, to me, I think it's a disservice to our adaptability as a species. Right. And like we're already seeing ways that people are doing things differently now than when we first entered social distancing and thought that this was only going to be a couple weeks. Right. So people were just sort of trying to live their normal life. People are finding ways to adapt. People are finding ways to connect. And if we accept that it's going to be this way for a while, right? And there are numbers suggesting that we may be doing this until 2021, right?
Yeah.
If we accept that that's how it's going to be and adapt and use technology to help us adapt, we can find ways to meet our social needs.
Right.
It's difficult, and I think as long as people are trying to live their old life, they will indeed be miserable in social distancing and yearn to go back to how it was. But I don't think going back to how it was is the only way for people to get their needs met here. It's just a matter of thinking creatively about different ways to do what we need to do. I have a colleague, actually, shout out to Doug Bradabo, who I used to teach with at Hiram College, who has a guest each week who comes and sits, all the way on the opposite side of his porch. And like he's got a planned, a whole planned, they ask a question, leave a question for the next person, and they bring their food with them and they take their food away when they leave. And so it's a complete social distancing dinner of just Doug and whoever he's invited. I think that's the coolest idea, right? I mean,
Yep.
It's by most, if not all accounts, safe, right? They're nowhere near each other. They're getting social contact. They're being in person with somebody. They're having a meal together, right? That's the kind of innovation I'm talking about, where like there are ways to do what we need to do, and you hear about them all over the world without going back to normal prematurely.
Mm-hmm. Get creative. I like it. So you mentioned chronic disease earlier and how that's connected to mental health. So can you just kind of expand upon that and how are those two really connected?
Yeah, so I think there are kind of two levels on which depression, anxiety, and chronic conditions are connected. The first is behavioral. So when you have a chronic condition, there are certain things you need to do according to your doctor, right? There's a treatment plan that you need to follow. So to give the example of, say, type 2 diabetes, right? There's certain food you need to eat. Exercise is very helpful. You need to monitor your blood sugar, right? These are all things that are very difficult to do if you are depressed and have no energy, or if you're anxious and overwhelmed and possibly distracted, right? So depression and anxiety can really undermine a person's ability to follow their treatment plan. So that's one important piece. There's also a more kind of profound biological connection where depression, for example, is driven by inflammation, right? So like there's all of this kind of interesting research that shows the inflammatory relationship of the feeling of depression and inflammation in the body. So if you combine that with an autoimmune disorder that's inflammation driven, right, you've got a perfect storm. There are ways that depression and anxiety can make various. I mean, there's a robust tie as well between depression and heart problems, which is less behavioral, though exercise is obviously important to heart health, but has a biological underpinning as well.
And are you seeing any specific trends with the connection between mental health and chronic disease, even with your Happify customers?
So, I mean, that's not a question I've looked at specifically during COVID-19, right? So, like, I've been very interested in general in whether a digital solution that's designed to help with mental health can help people with chronic conditions, because it's a distraction, right? So, like, if you're dealing with a chronic condition, are you then also able to have the bandwidth to take the time to improve your mental health, or is it just kind of so much going on that you can't do that? So we published a study earlier this year where we kind of validated that when you look at Happify users who have a chronic condition and you compare them with Happify users who don't have a chronic condition, and I particularly focused on people who said they had a severe chronic condition, that the impact and usage is exactly the same. And that makes sense given what we know about people's ability to adapt to things. Like, whatever you have, and that's kind of what I was trying to say earlier too about COVID-19, is that, people adapt to unbelievably difficult things. It's just a matter of accepting that it's the new normal and doing something different instead of trying to do things the way that you did it before. So it's kind of similar with chronic conditions, according to our research, that it doesn't seem like they're thinking about their chronic condition as, oh, this is so much to handle. It's their life, right? That's how they're living their life according to all of those things, and that's their normal. So when it comes to doing something new behaviorally, it doesn't overwhelm the way you might think it would.
Yeah. So you mentioned before that now within this pandemic, we all either personally or know someone who's having increased mental health challenges. So because this is the new normal and we all want to help our friends and family, what advice would you give someone who just wants to be there for someone they know is having a hard time right now?
Yeah, I recently published an essay in Psychology Today basically about that exact thing. Because as I mentioned before, I never had any kind of anxiety, but I found myself tackled by panic and general anxiety. And for me, I'm already pretty familiar with all the different types of mental health resources. So I kind of went for everything, right? So you have three main options in this COVID-19 environment. There's remote psychiatry, right? So, a psychiatrist you're already seeing or a new psychiatrist. So, like, personally, I use Doctor on Demand, right? So, like, I can only speak about that because that's the one I use. But in Doctor on Demand, they've got psychiatry and they have psychology, right? Like a therapist, and you can get either of those things. They're actually free right now, like at least under my health plan. So some places are reducing costs, but through telemedicine, you can access psychiatrists for potentially medication or psychologists for therapy or both. And I mean, those were always the options, but now you can do them in your house, right? So I think that it's a nice time for people who kind of thought, oh, I don't have time for therapy, or I don't know about medication, to reconsider that, because they're easily available. And even if there's a bit of a wait time, it's not, 3 months, which is what it used to be out in the real world. But there are good telemedicine services. It's video conference, just like this. So I think those are important. And then there are also these digital tools, right? So, Happify is one of them, but there are numerous digital tools right now giving away their products for free to people, various types of people. Some of them are like, oh, this is for healthcare workers, or, there's specific subsets that they give it away to. But I can at least say specifically for Happify that there's free content that's specific around kind of COVID-19 distress. And I've used it myself. It's actually, it's really lovely. So Tiffany's son, who's our head of content, has a way of kind of taking things and making them so appropriate to what a person is going through that I felt as I was reading it, yes, exactly, right. Yes, that is exactly what I'm worried about, or this is exactly what I'm having trouble with. So I do think it's important to kind of find things that you can do in your everyday life, because, a weekly appointment with a therapist may give you ideas for things to try, but it's not going to remind you every day to do it, right? Your therapist isn't going to call you up and say, hey, did you do this thing? So I find that digital tools and therapy can go hand in hand, in the sense that you may learn things you want to be doing in therapy, but then a digital tool can help you actually get it done.
Yep, that's great advice. And so just to wrap things up, any last thoughts or just kind of your predictions for the future, best way to move forward? What does the other side of this look like?
I mean, so, going back to that statistic we discussed at the beginning about 70% of people with a mental illness not seeking treatment, the biggest thing that I can possibly say is that during this time, like, can we stop that? Like, can we stop 70% of us being like, I'm not going to get treatment? Because I mean, there's greater openness now. I'm hoping, there's kind of less stigma, but the burden of mental illness on a society is so great, right? There are these statistics about work productivity and the ability to connect with family and children. All of these things deteriorate under depression and anxiety, and it's not fun either. Mm-hmm. So, there's never been a better time, with it being so acceptable to be experiencing these things, and with treatment being at your fingertips, there's never been a better time to take the leap and try it, right? Like, what's going to happen if you try it and don't like it? Then at least you tried it. But I was staggered when I first heard this 70% statistic 20 years ago. It's brutal. So I guess my best way forward that I can possibly suggest is to seek help. Let this be the year that the world learns to seek help when they need it.
I love that. That's a great place to end it. Acacia, thanks so much for joining us today. Appreciate you taking the time. And
Thanks
best of luck through the rest of this. Hope to catch up with you again soon.
Likewise.
Thanks. Thanks for watching this interview. We're doing our best to keep our health community up to date and informed as the pandemic progresses. So please check back for more interviews and blog pieces with leading health experts, as well as check out our Health COVID resource page for more information. Thanks again.